Good morning. Good morning. Welcome to this session. We are going to request all our panelists to come on stage. So once again, good morning and welcome to this session. We are happy to have you this morning. It is very early, but we appreciate your being here. My panelists, you're welcome. We are going to have this show run, but we also have some of our colleagues online and the technical team. Please confirm to us if it is all okay. But in the meantime, we shall begin. So we are going to be looking at this important session, lifting our voices. My name is Lilian Moreko. I work with the International Community of Women Living with HIV, and I'm a member of the Global Alliance on Ending AIDS in Children by 2030. So this session is close to our hearts. But previously, I was a member of the Global Validation Committee for HIV, syphilis, and now we are talking about the triple elimination. So we are glad to be here with you. And my moderator who will moderate this session is Florence Annan. Florence works with the Global Network of People Living with HIV. And we are glad to have the rest of the team that she will be presenting, taking into consideration that 45 minutes is just as little as that, and we want to really take more time digging deeper into this conversation. We want to get into a lot of talking about people's bios, but we shall allow her to give you brief about who is in the house, who is up here, and those online. And so we shall get into that. But we are going to be talking about key important issues in the validation process. We shall be talking about human rights, gender, and community engagement are three important components that are part of the global validation for elimination of mother-to-child transmission. And I would like now to hand over to my colleague to take us to the next level. Florence, please.
Round of applause for Lilian. Another one for all of us for being here this early in the morning. And we are here talking for our children, the ones we have, the ones we probably plan to have, the ones we may not plan to have, but we will have. Good morning, everyone. My name is Florence Riako Anam. I work for the Global Network of People Living with HIV. In my past life, not very past, I worked with these wonderful women and some in the podium. On the various seats I see here in the international community of women living with HIV. So this is a very power panel right here, and it's women-led. We are going to talk about the human rights component of ensuring that our policies about children and the elimination of HIV and syphilis amongst children within the validation of EMTCT is pretty much the work that women living with HIV have led in ensuring that it's rights-based and the rights components of it are captured in countries going through the validation process. It's a bit technical, but what you need to know I think for many people on the podium here and many activists, we realized rather quickly that going to spaces to talk about our experiences doesn't get us far. We then worked to ensure that there are some commitments and there are policies that, together with our partners at WHO or UNAIDS, we can be able to get countries making commitments around various issues that affect our lives. For children, for example, there is a WHO, World Health Organization's validation process for the elimination of mother-to-child transmission of HIV. Countries go through a process of screening, quality assurance, of which some of it is rights-based, not just treatment or service delivery. And when they qualify, then they are either bronze, silver, bronze, and gold level of validation. So that's what we are going to talk about today. To start us off is Sophie Brion, who is representing ICW Global and has worked with Lillian very closely around the global validation process, representing communities of people living with HIV. And I would like her to, she's joining us online, so Tech at the back, is that possible to get her on now? No? Just 1 second. So as we wait for Sophie, I will go to my next speaker. Sorry, navigating two documents here. So as we wait for Sophie to tell us all about what this is and what the work of ICW and GNP Plus has been generally, I would like to talk to Precious, who is representing ICW in Eswatini. Now, validation happens at country level, and it involves women engaging with the process at country level. So maybe that's a right place to start from, right? So that we can get to hear the country experiences. Precious, you are part of the Global Validation Committee. Could you tell us briefly about how the process at the countries happens?
Good morning, all, and thank you, Florence, for the opportunity. My name is Precious, as they have been said, and I'm part of the Global Validation Committee, which we call GVAC. Maybe the processes that would have to take place at country level is that at country level, the Minister of Health will have to send a request for validation. And once that request has been accepted, and then would have an opportunity as at country level where we set up a national validation committee, which we call it the NVC. And the purpose of the NVC is to collect evidence and also to report. So then the NVC will hold consultation at the country level, ensuring the meaningful engagement of everyone, and then we'll submit the report to the Ministry of Health. Once that has been done, the report will then be submitted to the regional validation committee, which we call the RVC. And then the RVC will review the national report and gathers evidence and prepares a regional report. And that regional report will then be submitted to the Global Advisory Committee, which is the GVAC, which will then evaluate these reports and ask for clarification where it is necessary. And then then a process of formal vote on the validation of that particular country will then take place.
Just as a follow-up question, how do the women really actually come together? Because then it must mean that you have to get their perspectives, their experiences. What kind of time and resources goes into a work like this?
Thank you, Florence. First of all, at country level, when you're going to apply for validation, there are already systems that are in place. So that means already the country is working with women on the ground. Because when we talk of programming, we are going to talk about gender equality, we are going to talk about program involvement and engagement, and then we are going to talk about human rights. That means you already have the structures that are there on the ground. And make an example, most countries have forums for women living with HIV. You would find that in a particular country, you would have ICW, and then where there is no ICW, there is a way for women together. You'd find that the Ministry of Health would already have set maybe the AIDS Council that would work in collaboration with the women on the ground. So that is where the process takes place, because during the consultation, we need to hear the voices of the women in that particular report and how they have been engaged, and if the process has been fair and transparent during the consultations.
Thank you very much. I understand you needed to do a poll. Is it you or is it Lillian? They have Sophie now? So then I will go to Lillian. Before we do the poll, I would just like Lillian to sort of build up on what Precious has said, because what I'm hearing, and we'll come to you, Tendai, in a minute, but what I'm hearing is for this to work, already the women networks have to have been formed. They need to be strong. They need to be in a process where they meet and collaborate and engage already with the processes at country level. So your country must therefore already be strengthened and organized around supporting women-led work. That's a premise. And then there needs to be some resources for the women to do work around validation. But Lillian, how does that move from the country to the global level? And how many countries really have been validated? Or maybe we want to ask people and then you can clarify that.
So thank you very much, and Precious, thanks for setting the scene. So the validation, as she says, starts at the country level. And we are grateful to WHO for really indeed taking up this mantle, because this is the first disease to be validated where human rights, gender considerations, and community engagement has been integrated. It is the first of its kind. So we applaud WHO. Give them a clap. And of course, it started at that level, integrating at the global level. But the call to action was that countries must make sure that on their validation committees, they have communities of women living with HIV represented, people representing people who work and are within the human rights, and people who understand gender and how it relates to HIV. So those are three important places at any validation committee that must be filled. So from the country level, then you go to the region, where you have regional validation committees or teams. And again, it must be the same way of making sure that these three groups are represented. And one of the things that we requested WHO and team to do, which they have also taken into consideration, is that it is not enough to have one woman living with HIV on a committee of 20, 30 people. It is important that there is some consideration to make sure that you're talking about, of also understanding that numbers, it may not be so big, but at least have two people or more to make sure that you're having, you're balancing the equation, that you're not talking about one person. And then the global, where Precious now represents us, and we have two people representing communities living with HIV. So to the countries represented in this room and that are planning to be validated, it is very, very important that the communities, human rights people, gender people, are not selected by you. Reach out to groups and communities themselves so that they select amongst themselves. Because it is important to have somebody who is grounded within an organization, within a community, so that they have a power behind them to support them as they take up that mantle. the challenge of picking individuals is that they don't have support. And here we are talking about institutionalizing these processes to make sure that they have a backup of their organization. And therefore, we call upon you to make sure that you go back to the organizations. And Florence, most of the countries that we know have networks of women living with HIV, networks of people living with HIV. We know that countries have organizations that are now dealing with human rights and law and gender. So it is not like countries are lacking. Countries have these organizations already there. What probably is not understood is the process of getting these people into place and making sure that they are grounded within the organizations. And that is our call to action.
I think Lillian's call to action it was going to be my follow-up question, but that really makes sense, that if you really want the community to lead, then you must let the community figure out who leads them in different processes, and we link to ongoing work. So the handpicking and the cherry picking will not get us there. I understand Sophie is online. Is Ajoa online? Okay, so let's go quickly to Sophie before we lose her. And to just listen, because Sophie has been helping a lot with the technical and the policy bits of our work, just to listen to her experience about what it takes to ensure and what exactly is the validation process from a technical perspective and how women living with HIV engage with it in that standpoint. Sophie is coming on video, joining us from Florida, I think, in the US. Thank you, Sophie. I know it must be really, really early.
It's early for you. It's earlier for me. I really wish I could be there with you all in Zimbabwe, and I'm very excited for this panel. I'm excited that we're talking about the validation process. Unfortunately, because of technical issues, I'm not sure, what has and hasn't been covered. But I guess what I think is really important to emphasize is that this process is a unique opportunity when we're reflecting on countries' achievements in the area of prevention of vertical transmission of HIV, syphilis, and hepatitis B, as we're thinking about how some of the criteria that maybe Precious touched on in terms of, the transmission rate, and issues around the coverage of programs, that we're really thinking about not just looking at paper and statistics, but understanding the lived experience of the women who are using those services and trying to learn and understand how we can, continually make these programs responsive to women's needs. And as Florence said, I've been working with the validation processes since 2014, really helping the process to incorporate this kind of unique focus. It shouldn't be unique. It should be for every validation, but this is sort of the first time that a validation process really has taken into account these human rights, gender equality, and community engagement aspects. And so it's really opened up rich dialogue in communities and led to a lot of really important progress around, making sure that the issues that are impacting programs at the point where women are accessing services have this opportunity to be heard and for a collective response to improve that process. So I think that's really the exciting part when a country is like, we've done a really amazing job, we're going to apply for validation. It's really this incredible opportunity for dialogue and to ensure that, you have networks of women living with HIV who can bring that lived experience, that, what is it like to use these services? What is it like to, be a woman living with HIV who wants to, have their reproductive, express their reproductive rights, have children or choose not to have children, whatever their choices may be. And how do we support them in a way that respects their autonomy and their rights to parent and choose their families. Some of the rights issues that I think, there's a longer list, and this is like a minimum criteria. But some of the issues are around bodily autonomy. They're around, are women being given informed consent, that they have, the information needed to make the decisions that are best for them and their families, and the time to consider, do they have bodily autonomy? Is there criminalization? Are women facing punishments or criminalization around aspects of their motherhood, whether it's, breastfeeding or other aspects, and what does that look like? And then also issues around stigma, discrimination, how accessible is the program to women? And when we think about women from key populations, for example, how are the programs responding to the needs, of women who do sex work, or women who, have used drugs or things like that? How are we building these programs that, to reach and support these women in their reproductive health journeys? I don't know if there's anything else that you wanted me to comment on, Florence, but that's just to sort of touch on why it's such a special process and why there's such a unique opportunity for the robust engagement of women living with HIV in this process, and why it's so important to hear from them on all of these aspects.
Thank you so much, Sophie. And I think you bring a very critical and important thing around how this work is linked to already ongoing work around addressing stigma and discrimination, bodily autonomy, and criminalization, among others. And Lillian, just to say, I'm going to come back to you after I talk to Tendai, just to speak a little bit the practical sense of the costs to bodily autonomy for women, and referring to the forced and coerced sterilization work that you've been doing and the recent win. I think it's something that we must sort of acknowledge and celebrate as a victory for ICW. But Tendai, you are hosting us in Zimbabwe. I must admit I'm eating a lot when I'm here. The food, it's restoring. But Zimbabwe is currently preparing for validation. And you and Papwick are leading on the work. How our community, we've heard from Precious about people who are already validated. Could you give us a sense of what it is like to prepare, to start to get the process going, and how women living with HIV are helping to support the country's effort to get validated, and what exactly is your goal?
Thank you so much, Florence, and good morning, everyone. I'm Tendai Westerhoff from the Pan-African Positive Women's Coalition in Zimbabwe, who are the national network of women living with HIV. And I'm glad to say, since the validation process started about 5 years ago, we were involved through the Ministry of Health and Childcare and the WHO and its partners. As women living with HIV, we are represented in the validation process. There are women living with HIV, there are young people's networks in there. There's the national network of people living with HIV, which is the NNP+. We have the gender aspect, that is Women Action Group to represent women. And we have the human rights, who are represented by lawyers for human rights, and the civil society. So our validation team at country level, it's very diverse. It has tried to be inclusive. And the good thing about it is all the people in there, they are not really people. They were appointed on the basis that they have an organization that will give them technical support, whereby whatever they are learning from the validation, they are able to cascade through their networks. As Papwick, we have 10 provinces where the information we take from the validation is cascaded through those 10 provinces up to community level. So from the time the validation process started, we were involved with the actual training of all the validation tools. Our focus really was on the tool of community engagement, gender, and human rights. As women living with HIV, we got that training from WHO, and we in turn are the organization of the women living with HIV. We trained the whole country on community engagement. What we expect, what we aspired, and what we understood, and what we wanted communities, how we wanted communities to be engaged in the validation process. Issues of community mobilization, ensuring that women living with HIV are involved from community level, district level, the PVC, that is the provincial validation team, and also issues of addressing stigma and discrimination, issues of catching women in all their diversities, including key populations, women who are of childbearing age, to all sensitize them about the importance of antenatal and prenatal care, breastfeeding, and all the issues, including family planning and sexual and reproductive health rights for women, and services as well at community level, because it is all these aspects that are looked at when the validation process started. And in Zimbabwe, we are still in that process. And I think we are also aiming for the gold. Recently this year, our team went to Botswana to learn about the success in Botswana around the EMTC program. And we have been involved with the country plan and all the trainings that come with it. But we just ensure that women living with HIV are involved at every stage, to understand also all the tools around the validation, the tools on human rights, the tools on gender, the tools on commodities. The tools are so many, but some of them is technical jargon. We are not really interested. We focus on the gender aspect and community involvement and human rights. And we always travel as the three of us, whenever we are giving this presentation, whenever we are training, to say, when we mean community involvement, it's about understanding the way the community lives and to identify who are the communities. What is the role of women living with HIV? Yes, we can do, what can I call it? We can do mobilization to ensure that women living with HIV go to the clinic. We can do sensitization, but it's more than that. We also sensitize our traditional leaders in issues of gender and also gender-based violence and also male engagement, because it takes two to tango for women to carry the pregnancies, to go to the clinics. And we also want the men to understand the role of this validation and the role of eliminating HIV in children. So there's a lot that we are doing, and I'd like to confirm here boldly that as a country, as women living with HIV, we have been involved through the structures that is being led by the Ministry of Health, National AIDS Council, UNICEF, UNAIDS, and the others. We've been on the table, on the planning of in the technical committees. We also sit in there. And we don't use individuals. We only use people who are coming from organizations where they are able to cascade the information. And like what Precious said, exactly what is happening in Swaziland, that's the structure that we also have. And we are being guided by the guidelines of the validation process from global level, as what Lillian explained. Thank you.
Thank you so much, Tendai. And I think what you're showing us is how this whole system works. The principles and the tools and everything is organized at the global level, with Lillian and people representing us, Precious, at the global level, making sure that the tools are inclusive and can hold countries accountable to involving people, but then the actualization of the work happens in country, and there's training, there's people willing to step up and take the role. There's a whole lot of community solidarity that needs to happen across the networks and across different civil society. It's like a system, and I think, and there's also cross-learning across countries. I just want to come up to you, Precious. So then, for this to work, there has to be some women living with HIV-led participation around the policy that is developed at country level, because then it means that whatever policy exists, the PMTCT national policy or EMTCT national policy, or whether it's a treatment guideline with a component or elimination of vertical transmission of HIV and syphilis, that must include this desire to get to elimination. Then what is, do you think then there's a role there to play? Was that your experience, and what was that in Eswatini?
Thank you so much, Florence. I would prefer to escape the Swatini part, but maybe let me speak at global level. I would say the role of women, it is to ensure it's not, when validation happens at country level, it's not a fault-finding mission to the Ministry of Health, but it is a collaborative effort where we all ensure that as a country we get a good validation report. So our role as women living with HIV, as much as we do sensitization, awareness, training, but we also need to go through the guidelines. What are the guidelines? What are the guidelines saying? Are the guidelines being followed at country level? And what is the report? It could be the preliminary report. When we go through it as women, also giving the technical expertise now as women to say, what is the report saying? Is there anything that we have missed as a country before we even go at regional level or even go at global level? Also trying to look at, because when we do validation, we are looking at gender, we're looking at the programs, we are talking about lab. Do all these aspects speaks together? So for us as women living with HIV, we also go to the lab people to try and ask them to break down the whole report, what it means, the impact, because it is also our role during validation to defend the report at global level or at regional level. So it is more on us taking responsibility as a country and as women living with HIV that we were part of the process, and we can confirm that there were no human rights violation and all the processes were followed, and we are happy with what the report reflects as a country.
Thank you so much, Precious. Lillian, have there been any challenges? Every journey has its bumps on the road. What are they generally?
So before I talk about the challenges, is Botswana in the house? Yes. Can we give them a shout out and a clap? Oh. So it is important to recognize where people have reached, and Botswana is the first country in Africa to be validated, to be on the path to elimination. And Florence, if time allows, I'm sure you're going to call upon WHO in the audience to tell us about that. But we also hear Namibia is on the road. Maybe we just shoo so that they can be more motivated to do it. So I'm sure Uganda is in the house. I want to shout out to you to make sure that, yes. So we are waiting for you and other countries. Of course, I have a, yeah, so what are the challenges? She's already started on, like her story tells us where the challenges are. That Florence, we are talking about policy, programs, and practice. So what gets validated is that the country, when the country is being validated, they are looking at what does the policy say? What are the programs saying? What are we finding or what are we seeing from the lab? And those ones, many times, they look great. But when it comes to practice, that's where the biggest challenge comes from. For example, you find a country has a policy that is very, very good in terms of respect for human rights, in terms of non-stigma and discrimination, in terms of gender considerations. But when it comes to the practice, when women living with HIV get into facilities, the experiences are different. For example, in some countries that we have gone through, you realize that some women have been coerced into sterilization. So the country has reached the level where they have, we can say they have eliminated. There's no problem anymore. But then you realize that women were coerced. It was not that they consented. No, they were coerced to be sterilized. And therefore, when you find a country that they are not registering new infections among children, it's because women don't have that right anymore. And therefore, that's where now the role of women living with HIV who have experienced this becomes very, very important. That they come up and say, yes, we don't have this on our policy, or we have never had any case in court, or we've never experienced this, from a policy point of view, but as a person, I've gone through it. And that matters, and it means a lot. It means that the programs that we have, the policies that we have, are not protecting the women. And therefore, when you listen to the women, it gives you that aspect that you begin to see that actually there's something that is not working right, that there is a gap somewhere. So that is one of the key things that we find challenging. The second challenge that we are having is that most countries, when this process, like it has been explained, that you must have these groups of people on the committees, that they must have an equal space and place to, to be and to engage. But in most countries, these people are not there. Some countries will tell you, there is a lot of stigma, so we want to get these women. But then when you go to the global network of people living with HIV and ICW, they tell you we even have a network here. And in some countries, there have been processes where groups of people living with HIV have come up with shadow reports. And that is not the intention for this process. The process should be, as she said and Tendai said, it should be collaborative. Everybody should be on board, and you look at the same, and you determine how you want to move forward and how you move forward together. And if there are issues at that level, then you begin to discuss, how do we address this? How do we move together as a team? Those are the two key things that we experienced, at least as when I was still there. And then the last one that I shouldn't forget is that many times you realize that, because like the two explained, the process should start down. It gets, validated at that level. The country agrees and says, this is where we are, and therefore we move forward. But the challenge that at the global level is that many times at the global level, the report gets there, and these processes have not been followed, and meaningful engagement has not happened. And therefore, when you're looking at the report, you realize that actually there are several things that we cannot get. And you're getting different, things, and you cannot move forward because what you're hearing, and it becomes even challenging for communities, especially if you're representing a community and your community is telling you, we were not involved, we were not there. The community is telling you there's a lot of issues. As immigrant women, for example, we are having challenges. As immigrant people living with HIV, it is really bad, and yet you're there and the report is saying something different. So those are some of the things that should be teased out at this level, that we'll begin to remember that it is not about validation based on data. It is validation that is based on so many things. And that it is not about being validated and you're celebrating when your citizens are actually in a funny state.
Thank you, Lillian. That's very powerful. We have time for just 3 questions or comments, but I want to, whoever is running with the mic, I saw a first hand go up over there, and I will give the lady over here first so that I look. No, I'm coming to you, Moko. I had a question to you, and then and then you, because I just saw 3 hands. Okay. Moko is over there with Nandita, and they're from WHO. I was going to ask my question, then you can say what you wanted to say. But I wanted to ask, what is the value of WHO doing this process? Does it help when countries are able to see each other and feel the need, for lack of a better word, to compete, to look good? I just lack the words for what it is, but Mike, please, to Moko.
Thank you very much, Florence. And shout out to all 4 of you. Honestly, you are brilliant ladies. We love working with you in WHO. WHO listens, and we really take your opinions very... It's on, yeah. We take your opinions very seriously. Like Lillian said, this is one system where we have the voices of women living with HIV as one of the most important things in validation. We acknowledge that it has been extremely helpful for advocacy. We are looking at the SDGs. We are looking at women, children, adolescent health. And this is one of the ways that we keep advocacy up when it comes to HIV in particular. But now with triple elimination, we are doing HIV, syphilis, and hepatitis B. Very powerful words from Lillian and Tendai. We also feel that it's important that there's a two-way communication between the representatives and the community. And sometimes there's no real guarantee that this is happening. So we hope that groups like this will continue to push. So we know that we are really getting the voices from the grassroots and not just the one or two people who happen to be on the NVC, RVC, or the GVAC itself. So it's very exciting that we can sit here and discuss this. I think I will emphasize again, WHO listens. And I wonder, is it time now for us to hear the voices of the men? Because yes, this is something that pushes women up. It's been very important. It's really helped to move the program. And other systems in WHO are also looking at having the community as part of the validation. So yes, very well done. But do we also think about how it would be better to also have representation further down from men probably in our region? It may not be coming out, but in regions where the men have quite a lot of power, where they decide on who goes to hospital or what, it's important that we have their voices and we hear that. But then we are depending on you to really help us in that direction. But again, I say kudos, very well done, and you are very well appreciated. Tendai, well done.
Thank you. Oops, sorry. Thank you so much, Moko. I think there's a value in countries going from bronze, silver, and it motivates, I think, and maybe that. And I think Tendai and Precious and Lillian have said one of the best ways to ensure that there's this constant communication back and forth and there are more women is if we don't cherry pick individuals, but we have people that are connected to networks, right? So that there's a system for feedback, for consultation, etc. Great. Let's listen to the man.
Thanks so much, and I really love the deliberations this morning.
Could you please tell us who you are?
I'm Raphael Edujemfi from Ghana. Yes. My question is, when it comes to, triple elimination and the deliberations we are having, what's the definition for gender equality? What's the scope for this? And then for all these three concepts, the human rights, community engagement, and gender equality, what weights do they contribute to the validation, score? And yeah, I just want to get these two. Yeah, thanks.
Thank you very much. Mike, to the front. Let's just take the three questions and then we can quickly answer as we close.
Okay, thank you for the presentation. My question is like a general question. How effectively can we monitor the implementation of policies? Thank you.
Thank you very much. My question is on the measures which you use when it comes to considering human rights. The Afrocentric human rights discourse looks at group rights, communal rights, I am because I relate, as opposed to the Eurocentric human rights discourse, which looks at individual rights, I am because I think. How do you strike the delicate balance between the diverse human rights discourses which exist in Africa and in the West? How have you managed to validate within that situational analysis? Thank you.
I think I want to give the speakers a chance to respond to the questions as they give their closing remarks. So can I distribute the questions? Because we don't have time. So which one? This was deep, eh? Afrocentric, Eurocentric, I am. You want to take the last one?
The last part and the last part of him. I hope I understood.
Okay, so Tendai will take question 1 and 3. Lillian will take question 2. And I think, Precious, please sort of just broadly respond to Moko's comments. And as you give your final remarks around your appreciation and what you think could possibly be the more important thing for communities and policymakers to take for this process. You all have like a minute each. Okay, go, Tendai.
Thank you, Florence. For that other question, I would need to be reminded again so that I answer it properly. I'll start with the last bit of this question. From our experience in the NVC, the lawyers for human rights, they come and train on universal human rights, and then they break them down. Health rights, sexual reproductive rights, and all these things are also linked to the constitution of the country and the policies that we have at country level to support human rights, to protect human rights of women and human rights of everyone. So that's how they break them down so that they fit in to the tool of what the validation will be looking at. So from a layman's point of view, that's what I understand the context. And then the other question, he said, the definition of gender equality, I think, sorry, the scope of gender equality, I think that is about addressing, I can say, equalness between men, women, irrespective of orientation, that all of you have access to services, you know, that others don't get more, others don't get less. But if we go to the clinic, are there services for men? Are there services for KP? Are there services for women? Women who are breastfeeding, etc., etc. Even in the distribution of resources, Lillian touched a bit. These structures that we are talking about, the networks, they lack the funding part. And sometimes we can just do so much, but everything needs money. There has to be investment in networks of women living with HIV so that we can deal with these issues, so that we can also effectively participate in the validation processes. And it goes beyond just the validation, you know, because it's also touching on other scope to fight the pandemic, to end HIV in children, etc., etc. And at this point, I also like to say that to appreciate ICW East Africa and GNP+, I think they also made a deliberate effort to give extra training on these issues to women living with HIV in Zimbabwe. And the grassroots women this time, we mobilized them to take part on the virtual. And we got all the support to ensure that they are also trained virtually, they understand the issues. But sometimes that support is not there. Thank you so much. I think my colleagues can also add to what I left out. Thank you.
Lillian, your question was on how do we measure policy progress?
You know, some of these questions, we have to answer them together. So in such a situation, as countries, how do you think we should be measuring policy, practice, programs, funding she's talking about? These are the questions we should now be answering ourselves at country level. And I want to throw it back to us that we need to get that level. There are so many things that are being measured, but one of the areas that is not being measured well are policies. The policies, the constitution that she's talking about. In my country, we have a very nice constitution, but the question is, does it relate to our policies? Is it what we would want to see? So those are some of the things that we are struggling with that we must be addressing. And therefore, I'm not going to just give it, like a clear answer, but that is one of the sticky areas that we need to get into. And my concluding points are, Tendai has stolen some of them, but the few that are remaining is that we've been asked by WHO, where is the role of men? It is a question to the countries now that as countries, you have a leeway to bring everybody who matters in the response on board. And WHO does not dictate who you bring on these committees. So the call now is making sure that you're able to bring whoever matters on table so that they are able to contribute to this process. But doing it in a way that does not take away the seat for those who are already there. So let's integrate, let's bring more people. We can even bring them as technical people if the group is becoming bigger, so that you don't need to have to fight for space. But when you need these people, in terms of giving you the knowledge, the information you need, you bring them. So because we can go on and on, we are going to talk about children, we are going to talk about young people, but these are very critical if the process has to give us the best outcome. And lastly, but not least, you've been hearing, we've been talking about children, children, children. The children are left behind, and we need to shame ourselves that children, if you looked around this conference, we don't have children because they cannot be there. We have to be there for them, but we are not doing a good job for them. We are not representing them well. And therefore, if there was any genocide that we could be charged, these children should charge us